to see you again.
Good to see you.
All right, so I understand that something's bothering you. What have you noticed?
I've noticed some pain on occasion when I'm chewing.
Okay.
Yeah.
Yeah. And how long have you noticed this, would you say?
Probably for the past couple weeks.
Okay.
I was hoping it would go away.
Yeah, that's a good time. Sometimes they do, but sometimes they don't.
Yeah.
And do you notice it when you're chewing all foods, or is it just certain foods?
You know, just certain foods.
Okay.
Not all foods.
Okay. And how often do you notice it? Every day?
Almost every day, but it's not every time I eat.
Okay. And any cold sensitivity? You drink something cold, do you notice it? If you eat something cold?
I do sometimes, yeah.
Yeah. Okay. All right. So at first glance, it seems to me like you may have a crack in that tooth. Okay. If you've had an existing large restoration when you were younger, in your teens or 20s, a lot of times over the years, those forces build up, and sometimes a crack in the surrounding structure can develop, and then you get those symptoms. That may not be it, but that sounds like the most obvious thing. So I'm going to go ahead and do some tests, and we'll see if we can figure that out. Okay?
All right.
All right. So are you avoiding chewing on that side?
Well, now I am.
Now you are. I'm going to test another area. Okay, bite together, squeeze. Good. How about that?
No, that's
No?
not it.
Okay. All right, right there, bite a little harder. Okay, I'm just gonna squeeze. Oh, you felt that, huh?
Yeah, I felt that one.
Okay. So would you say, were you able to tell, did you notice that when you were biting or when you let go?
When I let go.
You let go? Okay, let me do a little more testing here. I wanna try that again. Okay, bite together, squeeze, open. Good. You notice it, okay.
Yeah.
So it seems like it's that tooth. That's your second bicuspid or premolar. And as I look at that tooth, it does have a very wide existing filling. I don't see any cracks in the teeth. A lot of times, if there is a crack, we don't see it. So sometimes they're difficult to diagnose. But based on your symptoms that you described, the chewing sensitivity on certain foods, sometimes the cold sensitivity, and the fact that I was able to replicate your pain with this, it seems pretty clear to me that that tooth has a crack. Yeah. I'm just gonna tap on it. It probably won't be sensitive when I do that, but I wanna check. Any sensitivity there? No. So what I wanna do is I wanna take an x-ray of that tooth. Cracks don't show up on x-rays, but I need to check just the overall health of that tooth and the nerve, so I wanna make sure nothing obvious besides a crack is going on with that tooth, okay?
Okay.
So I'll set you up, and then Heather will take that picture, and then we'll talk some more about what we would do to treat that tooth to make you feel more comfortable, okay? All right. So as I suspected, the x-ray looks fine. There's no pathology that I can see. There's no decay. Your existing restoration looks fine. The health of the nerve looks okay. So I think we're just dealing with a crack. So the issue becomes, well, how do we fix that? How do we make that more comfortable for you? So the treatment for a crack is traditionally a crown, something that surrounds the tooth and holds it together and prevents the temperature getting into the tooth through the crack and the biting pain from the flexing of the tooth. Now, yeah, so I know you've had some crowns in the past, and most times what we find when somebody has a crack in the tooth and we get the first stage is to put a temporary crown on there, most times you feel fine, you get relief. You can chew on it, it's not sensitive to cold, and then we move forward with the permanent crown. If we put the temporary crown on and you're still having symptoms, it may mean that that crack actually extends further into the tooth and might affect the nerve, at which point we would have to consider maybe getting a root canal, okay? But most times getting the temporary crown makes everything feel much better, yeah.
Okay.
Yeah. And then I would say in the meantime, until we get you back for treatment, just avoid chewing on that side, which you're already doing. Again, a crown is something that surrounds the whole tooth and provides protection for it. And in order to make room for the crown, we need to remove the existing filling that's there, and then a certain portion of the enamel around the tooth. So here's an example of a nice ceramic crown, and we do a lot of ceramic crowns these days. We do some metal, but mostly ceramic. And you can see it looks like a real tooth from the outside. And then when we lift up, you can see there's the tooth below it, where we've removed all the filling material from the top and then about 1 millimeter of enamel from the outside. That way we have enough room to make a restoration, the crown, which then fits over the tooth and is cemented on, okay? And once it's in place, it strengthens the tooth and again protects against the symptoms that you have from the crack. We try to make it look as natural as possible, and the ceramics, the technology is really amazing now, so we can often do that easily. And you can see when we have the simulation of your other teeth closing down on there, it's usually a perfect fit. And most times it's very comfortable. So it's a really fantastic treatment when it's needed. And as I mentioned before, at the first appointment, I'll do all the work. We'll take an impression. The impression gets sent to the dental lab. We'll fabricate this crown. In the meantime, you'll have a temporary crown, which also looks very lifelike, and that will keep everything stable until this crown is ready. Okay. And most times what we find is once we put the permanent crown in, after a small adjustment phase, it feels like a very natural tooth. You don't even notice it anymore. Probably the best solution to a single missing tooth is to have an implant. Have you heard of dental implants before? You have, yeah. So a dental implant is just, it's a replacement of that tooth. And the way that's done is there's a surgical placement of a titanium post where the tooth used to be. And once the bone heals around that, over a period of 3 or 4 months, it's solid. And then you can come back and see me and we can design a custom crown that will fit onto that implant. It's the closest thing to replacement of a natural tooth that we have, and most people are incredibly happy with them. And the other great thing about them is that hopefully it's a lifetime restoration. You can't get decay on it. So as long as you keep the gums healthy around it, a lot of times it'll last you the rest of your life, okay? Other option, it's more of a traditional older option before implants, but certainly still an option, is to do what we call a 3-unit bridge. Okay, we've talked about the crowns, but if you have a missing space, you can put crowns on either side of the space and then they're connected with a crown in the middle. So it's a permanent bridge that sits on the adjacent teeth and spans that. So that's effective. It doesn't take that long to do. The downside is that you have to work on both teeth around the gap to come up with that restoration versus the implant where you're not touching any of the adjacent teeth. So, there's pros and cons to each of them, but those are essentially the 3 choices to deal with a missing tooth.